Hey, how's it going, everyone? This is FixerMed, and welcome back to my high-yield biochemistry review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 12 of my multi-part video series detailing and describing the entire discipline of biochemistry in a high-yield but comprehensive manner. So without further ado, let's go ahead and get started on today's lesson. Today we'll be primarily discussing collagen disorders. So let's go ahead and get started. Type 1 disorder. Where is this collagen disorder found? It's mainly found in bones with delayed wound healing. They appear white and exhibit greater tensile strength when compared to type 3 collagen. The main diseases involved with type 1 collagen disorders include osteogenesis imperfecta type 1. In osteogenesis imperfecta type 1, fractures occur at various healing stages, commonly misinterpreted as child abuse, and it may be associated with blue sclera, although often omitted in questions, because if you see blue sclera, it's a dead giveaway for osteogenesis imperfecta type 1. Additionally, conductive hearing loss due to ossicle malformation is observed in osteogenesis imperfecta type 1, so keep that in mind. And when osteogenesis imperfecta and child abuse are ruled out, osteopetrosis should be considered. We'll be going more into detail on this content in the MSK High Yield Review series, so don't worry. Moving on, type 2 collagen disorder. Where is this disorder found? It's found in cartilages, intervertebral discs, and the vitreous humor. The main disease associated with this type of disorder is Stickler syndrome, where congenital hearing loss is observed. Moving on, we have type 3 collagen disorders. These are found in blood vessels and early wound healing. They are typically pink in color with lower tensile strength compared to type 1. As noted earlier, the main disease associated with type 3 collagen disorders are the Ehlers-Danlos vascular type. So Ehlers-Danlos vascular type is the main disorder associated with type 3 collagen disorders. In Ehlers-Danlos vascular type, you see hyperextensible skin / joints observed. You'll see easy bruising, which may be linked to aortic dissection and regurgitation. And you'll see mitral valve prolapse, saccular aneurysms in the circle of Willis. And that's it for Ehlers-Danlos. Moving on to type 4 collagen disorder. Where is it found? It's found in the basement membrane, basically near the kidney and alveoli. Main diseases associated with type 4 collagen disorders are Alport syndrome, Goodpasture syndrome. Alport syndrome is an X-linked recessive disorder caused by a mutation in type 4 glycogen, which manifests with ear and eye issues in males alongside hematuria. In contrast, Goodpasture syndrome is characterized by antibodies against type 4 collagen. This affects males in their 20s to 40s, preventing hemoptysis and hematuria with a distinctive linear immunofluorescence pattern on biopsy. Now I'm just gonna give you guys some pictures related to the collagen disorders and their diseases. As you can see, these are the blue sclera from osteogenesis imperfecta type 1 collagen disorder. This is the hyperextensible skin from Ehlers-Danlos, the vascular type 3 collagen disorder. And this is how the linear immunofluorescence pattern looks on biopsy from Goodpasture syndrome for the most part. It's usually green, and sometimes you might get the picture, sometimes you won't get the picture, so just keep that in mind. Let's move on to the NBME application-based reasoning questions. So we have a researcher exploring the primary structure of a molecule defective in osteogenesis imperfecta. Which amino acid is expected to be most abundant in this molecule? This is pretty first order, so I expect most of you guys to have your answer down already. Give you a few more seconds. Moving on, if you guys need more time, please feel free to pause the video. So in the primary structure of collagen, known for its role in osteogenesis imperfecta, the sequence is glycine XY, where X and Y are typically proline or lysine. And glycine typically constitutes 1/3 of the collagen, as seen here, and proline lysine are the 2/3. And this is later hydroxylated to form hydroxyproline and hydroxylysine. Therefore, the correct answer here is B, glycine. Let's go through why the other answer choices are wrong. The incorrect answer choices can be explained as follows. Alanine. Alanine is not the most abundant amino acid in the primary structure of collagen associated with osteogenesis imperfecta. C. Proline. While present in collagen, it is not the most abundant amino acid. Glycine holds that position. Lysine. Important in collagen structure, but not the most abundant. Glycine takes precedence. Hydroxyproline is a modified form of proline, and while crucial in collagen, is not the most abundant amino acid in the primary structure. Glycine holds that distinction. Let's move on to the next question. We have a 24-year-old patient that presents with hypermobility of joints, easy bruising, and hyperelastic skin. Genetic testing reveals a mutation in the COL5A1 gene. What is the most likely diagnosis? Pretty straightforward. There's some buzzword here that should help you out. Give you guys a few more seconds. Alright, moving on. If you need more time, feel free to pause the video. The symptoms described, including hypermobility of joints, easy bruising, and hyperelastic skin, are indicative of Ehlers-Danlos syndrome, EDS. The mutation in the COL5A1 gene is associated with the classical subtype of Ehlers-Danlos syndrome, characterized by abnormalities in type 3 collagen, leading to the clinical manifestations mentioned. Therefore, the correct answer is Ehlers-Danlos syndrome. Let's go through why the other answer choices are incorrect. The incorrect answer choices can be explained as follows. Osteogenesis imperfecta is primarily involved with bone fragility and deformities, not hypermobility of joints and hyperelastic skin, as seen in this case. Marfan syndrome. Features include tall stature, arachnodactyly, and cardiovascular abnormalities, but not the characteristic hypermobility and hyperelastic skin. Alport syndrome. Presents with renal and ocular abnormalities, not joint hypermobility or hyperelastic skin. Stickler syndrome. This involves craniofacial abnormalities, hearing loss, and ocular issues, not the joint and skin manifestations described in this case. Let's move on to the next question. So we have a 5-year-old child that presents with recurrent fractures, blue sclera, and hearing loss. Genetic testing reveals a mutation in the COL1A1 gene. What is the most likely diagnosis? Alright, I think I gave you guys enough time here. If you need more time, feel free to pause the video. Otherwise, moving on. The symptoms of recurrent fractures, blue sclera, and hearing loss are indicative of osteogenesis imperfecta, OI. The mutation in the COL1A1 gene is associated with osteogenesis imperfecta, a collagen disorder characterized by bone fragility, deformities, and other connective tissue abnormalities. Therefore, the correct answer for this question is osteogenesis imperfecta. Let's go down and break down why the other answer choices are incorrect. B. Marfan syndrome. Features include tall stature, arachnodactyly, and cardiovascular abnormalities, but not the characteristic recurrent fractures and blue sclera seen in OI. Ehlers-Danlos syndrome. Presents with joint hypermobility, skin hyperelasticity, and easy bruising, not the recurrent fractures and blue sclera associated with osteogenesis imperfecta. D. Alport syndrome. Involves renal and ocular abnormalities, not the bone-related manifestations described in this case. E. Stickler syndrome. Characterized by craniofacial abnormalities, hearing loss, and ocular issues, not the recurrent fractures and blue sclera seen in OI. So, that should give you a lot of information on collagen type disorders. Collagen disorders are actually pretty easy to memorize in my opinion, so if you have any questions, comments, or concerns, please feel free to leave them in the comment section below. And as always, be sure to have a great day. This is FixerMed signing off. Good luck studying, guys.